This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Musculoskeletal Pain and Injury on Wednesday, November 2nd at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on anything you want to know about in the world of your body, actually, from a natural point of view. Whether you've had a problem, you've tried, you've applied, you've done whatever you think you can do, well, here's an opportunity. Let's fix it, without drugs, without surgery. Let's see what we can do that makes a difference in your life. Call us, 888-630-9625. That's 888-630-9625. We do have a topic today, one that is, unfortunately so broad-based that it's often difficult to figure out what it's all about. And what are we talking about? We're talking about musculoskeletal pain and injury. And, on the surface, it doesn't seem to be that involved, but trust me, it is. Musculoskeletal pain and injury. Actually, what we're talking about is the unresolved musculoskeletal pain, things that hurt you all the time, and you've done everything you can to make a difference, and you may get some resolution, but it really never gets to the place where it's 100%. There is a why is that. There is a why those things occur and why you can't get to, but you know what, better than me, and it always compliments me, and I'm always excited to kind of, discuss things like this with somebody who I have tremendous admiration for. Who am I talking about? The professor, Dr. Harlan Browning. Welcome, sir.
Hey, Tom. Good to be here as always.
This is your topic this Wednesday evening at the Roselle Center for Healing at 7 p.m. You're going to be talking about musculoskeletal pain, particularly unresolved patterns, and how people can turn this stuff around. Let's get into it a little bit, and then we'll kind of get specific as we go through. But, in preparation to do the program with you today, because I always have to be on my toes with you, I looked up this myofascial pain syndrome and chronic pain disorders, and we can encompass it from fibromyalgia to myofasciitis to, you name it. Actually, the list goes on like crazy, but, just to name a couple. But we're talking about musculoskeletal pain, so I'm going to let you kind of define the paradigm of where we're going to kind of, walk through the weeds on this thing, because it is so broad-based. So what are we talking about?
Well, this seminar we're going to do is specifically about what we call the fascia. And the fascia is the saran wrap that encompasses a lot of our organs, our muscles, and a lot of the structures in our body. It wraps everything, and it is pretty much contiguous from the bottom of our foot to the top of our head, and it's not talked about enough as far as being a generator of pain, and certainly being something that becomes compromised as we have injuries, or as our posture becomes poor, and we're going to look closer at that. So I think it's going to be very interesting.
This is something, as you said, people don't really understand that this wrapper of fascia, if we'll coin the term fascial plane patterns. And what that really means is that you've got the saran wrap that kind of covers everything, muscles and ligaments and tendons and organ systems and bones and so forth. And it's really all one piece. and it connects from one area to the other, to the other, to the other throughout the body. It's an amazing structure and how this all comes together. And it can be very, very tough. It can be very thick. It depends on the organ system and so forth. But when it is not addressed in any kind of structural pain, you have an unresolved situation that never goes away. Let's talk about injury. How does this occur, injury or presentation? How do we end up with these myofascial problems that seem to be the underlying, and we use the term why is that we can't identify and never, ever, ever is addressed properly?
Well, typically it happens over time. And when we think of the fascia, it's a very fluid compartment, so there's liquid in it, literally liquids. And what happens is these liquids will either become isolated in one area or they'll actually dry out. So because the fascia transmits forces across the course of our body, if the fascia becomes restricted, we don't do that well. And as we don't move, then the body starts to break down.
So when you have fascial restriction, and I look at it as like two pieces of paper that are supposed to glide over each other, or two pieces of fabric, even a silken fabric over a piece of woolen fabric. They don't glide quite as easily, but they should glide. They should move. They should have fluidity so that we can stretch and bend and open ourselves up and so forth. Same thing not only for muscles but organ systems. So we end up with that dryness of that fluid, or we end up with impact injury, or we end up with tenting and tightening of that fascia, and that is the mechanism that causes, if I can use the term and correct me if I'm wrong, recidivism.
That's correct. And the one thing about the fascia, outside of the retina, it's really the most heavily laden with sensory receptors, meaning that our body knows exactly what's going on and where we are in space because of this fascia. So we have this ongoing receptor system that tells us where we are in space. So if we start to damage it, not only do we develop pain, but now we have different movement patterns, which often compounds the whole situation.
So it allows us to stay balanced in space.
That's it.
Exactly in our environment.
It. Yes, and there's a whole fascial conference, believe it or not, where there's the smartest guys in the world come together and talk about the importance of the fascia. And as we know more and more about it, we're really realizing that it's this fascia that's causing a lot of the issues, and not so much the muscles and the joints that we thought were the primary problem.
So a lot of our patients that let's take our older patients that have a difficult time even moving and standing balanced. We use that term. It can be a myofascial component more than other things?
Oh, certainly. Either because the fascia doesn't move properly or because the fascia has been injured or damaged and it's not giving the information to the brain telling us exactly where we are in space. So we might feel like we're in one place, but we might be kind of slightly to the side.
My guest in studio, Dr. Harlan Browning. The number here is 888-630-9625. Love to talk to you. We're talking about myofascial problems, or particularly musculoskeletal pain that just doesn't go away. It's going to be the topic of the program he's going to be presenting this Wednesday evening at 7 p.m. at the Roselle Center for Healing. And if you've got these problems, if you're kind of locked up, you can't open up, you can't stretch, you try to do something and it hurts you to do that, so you stay in a cramped position or bent over position, or you've done everything you can, but this area hasn't been addressed. This is an opportunity for you this Wednesday evening to find out what to do about it and actually what the why is behind it. All you need to do is call the Roselle Center at 703-698-7117. That's 703-698-7117, and tell them that you'd like to talk, or you'd like to sit for Dr. Browning, the professor's presentation. And trust me, there's a reason we call him the professor. This guy's over the top. He knows his stuff, and he's going to present it in a very straightforward, very complex information that you're going to walk away truly, truly understanding and getting the why behind it. Dr. Browning, let's talk a little bit about, kind of differentiating these conditions, because there's many of them. I started to touch upon it in the beginning of the program, but when we talk about pain patterns, myofascial syndromes, we talk about everything from fibromyalgia to myalgia to myofasciitis, shortening the myofascial layers and so forth. How do you differentiate which is which? I mean, are these just blanket terms that people get because there's really no distinguishing factors, or are there separations, and do you treat them? Do you look at them differently?
Well, certainly that you can have just a garbage pail diagnosis of myofasciitis, which literally just means that there's inflammation of the musculature and the connective tissue. I think the best way to approach it is to look at the pain pattern. Where is it coming from? When does it get better? When does it get worse? Is there a causation? Did the person have an injury? And can you reproduce it? That's a big thing. If you can reproduce the pain, it's going to give you a better idea of where it's coming from. But for a lot of folks, let's take example, the folks that have fibromyalgia, everything reproduces their pain. So you need to look at multiple systems when that comes into play.
When we're talking about this myofascial pattern, this saran wrap, this covering that goes through everything and around everything and on everything, it's a situation where if you go into the general literature, they talk about an overstretch injury, to this. But that's not what it is. That's not what I see regularly being an overstretch. It's often more of a tenting, a crimpling, a contracture in other areas than it is that one area that's overstretched. The overstretched area may be secondary to something else. Which is true in your opinion? What do you see?
Well, I think you could see both of those situations. Certainly, in an injury like, let's say you roll your ankle, you're going to stretch the fascia out and damage it. But I think you're right. Most of it comes down to the shortening of that fascia over time. And as that fascia shortens, like you said, it will literally start to tent, and the quality of the tissue will change. There's something called a basement membrane, and that's what it's all about. It's the nuts and bolts of what's going on in the tissue. And if that starts to change over time, it hardens. And as it hardens, then it becomes less pliable, and it emits a lot of pain.
We're talking about myofascial pain syndromes with Dr. Harlan Browning. He's going to present the topic this Wednesday evening at 7 p.m. Love to have you as our guest. Love to have you have that aha moment, and not only more than that, be able to know what to do to fix it. If you have a question, if you think you have a problem that is related to that, give us a call right now. 888-630-9625. That's 888-630-9625. And ask the question. Let's see if we can work it into what's going on with you and make a huge difference. This is a problem that is significant. It's impactful. It's a chronic disorder, if you will, for many, many people. And what I see, Dr. Browning, is that, so many patients that have come into our practice have gone to many other practitioners, and they've been given steroid injections. They've been given injections for trigger points. They have been given pain medications, anti-inflammatories, and so forth, for this chronic problem that never seems to go away. And even to the point where they've given psychogenics to try to relax the body and dumb down the receptor sites. But all of those things are directed to a problem that we're talking about that has its initiation in many different areas. How do these things come about?
Well, I think you need to look at how the fascial networks connect to each other. We call it anatomy trains. In other words, one part of the body attaches to another to help transfer force. So even though we have pain in our shoulder, we might be having issues outside of the shoulder. So we have to look at how the shoulder moves, the tissues that attach to it, and sometimes we have to go further down. It could be a primary foot problem that causes the ultimate shoulder issue.
When we talk about our business, we look at structural, chemical, emotional pathways as it relates to anything. This is kind of an interesting phenomenon as well. The myofascial patterns have a nutritional component to it as well. And often we see that as the initiating force. You got about 45 seconds before we got to take a break to touch on it, then we'll come back and finish it up a little bit.
Well, the basic part of it is what we call glycosaminoglycans, and we all have heard of chondroitin sulfate, hyaluronic acid, glucosamine. That's what makes up all the fascia, just as well as it makes up our joints. So if we start to deplete those, or we don't have enough quality diet, then we're going to have issues.
I want to touch on that. I want to get back to those repair-building substances, but also deficiencies in a very, very common vitamin and its carrier, because without that, we have all kinds of myofascial problems and some that never go away. But the combination of these two things, one's reparative, one's presumptive, and we'll see what that's all about. We're coming up to a break. Don't go away. I have the professor in studio with me, Dr. Harlan Browning. You're listening to Dr. Tom Roselle Live. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live in studio. Call us, 888-630-9625. That's 888-630-9625. My guest in studio, Dr. Harlan Browning, your host this Wednesday evening, 7 p.m. at the Roselle Center for Healing. He's going to be talking about musculoskeletal pain and injury, things that don't go away. But he's going to be talking about from the myofascial pain pattern syndrome. What does that mean? A lot of these injuries occur and they just kind of hang on because the underlying problem, the unresolved musculoskeletal pain, is not being dealt with properly, and that's the myofascial linkages, these myofascial trains, as Dr. Browning said earlier in the program. And we want you to understand that there's things that you can do about them. Just to sit there and say, hey, I'm going to take these pills for the rest of my life, and there's nothing I can do about it. I've done everything I can. Not really. You have to understand the mechanism. Dr. Browning, we touched it a little bit. We have some calls coming in, but we're going to, I want to go through this one piece first. We talked about the nutritional components, some of those triggering mechanisms that we've done things. People have gone to myofascial therapists. They've had trigger point injections. They've had Rolfing done. They've had good, structural care done, but it doesn't go away because, and even if they've addressed the fascia, there's an underlying nutritional component. And one that I kind of alluded to, that is a nutrient that's very common in it. And when people are anemic, they show up with pain patterns as well.
Yeah, certainly there's a lot of folks that are walking around that are just chronically inflamed, and they're taking over-the-counter NSAIDs, Advils and things like that. The issue becomes is the inflammation causes the degradation or, the destruction of the tissue, and then the tissue actually becomes fibrotic. It becomes scar tissue, which is, going to be a permanent situation. So if you don't address the inflammatory component, it's like slow seepage. It's just going to continue to move to different parts of the body. And unfortunately, the over-the-counter meds, they starve the body of sulfur, and sulfur is one of the most essential components of connective tissue. So it feels good temporarily, but in the long run, it becomes more destructive.
How often do you see a patient who, has these chronic problems, but you also see them with a pernicious anemia problem? And what I'm alluding to is the commonality between the transportation and absorption of B12.
Certainly your cofactors like folic acid and B12 become very important. Just basic things like hydration. If you're not getting the liquids in your body, you're going to dry out, and over time that's going to cause a toll. Certainly when it comes to people with chronic pain.
Chronic pain patterns that are due to these myofascial interrelated conditions are devastating. They can be things that stop your life, and you don't know why they happen. The pain syndromes that come about, we talked about earlier on, from fibromyalgia to myofasciitis to myalgia. The names go on, and some of them are just bushel basket terms because people are hurting all the time. These myofascial problems, Dr. Browning, a lot of them are subscribed to athletes. You see them coming in, and it goes to having dealt with a lot of the professional athletes. We see that many of them, their dietary patterns stink. They're awful. They have a training table that's not too bad, but the stuff that they eat on their own or outside of that. Our patients, our audience that's listening, how much of dietary deficiencies predisposes and contributes to the not only the onset but the progression of these conditions where they're unrelenting?
I think it has a lot to do with it. Certainly, we see people who are protein deficient. The types of proteins that they're eating are very poor quality. And I think the big one is they're eating foods that have a lot of bad fats in it. So these bad fats, these inflammatory type fats that are in vegetable oils and things like that, cause our body to go into this inflammatory cascade. So if we don't change the diet, we're often not going to change the issue.
So somebody gets hurt, they get a blow or they get a bump or they stretch too far or they bend over to pick something up, and all of a sudden they're in pain. And the structural component from a skeletal point of view or a muscle point of view seems to be straightforward, but it's that capacity, that wrapper, that fluid in between the fascia that you've talked about that is resistant to, if I can use the term, just kind of laying itself flat and laying down so everything else can work properly. And now we have something that is chronic and never goes away.
Yeah, and certainly because the fascia invaginates and wraps around everything, it's the great mimicker. So if we have knee pain, it might not be because there's some sort of derangement or some sort of problem in the knee itself. It could be that the fascia that wraps around it and the outside of the leg is called the iliotibial band, and it's the classic example of something that will cause a problem at a joint, but it's really not a joint issue.
So that the iliotibial band, for our listeners, is a muscle that's kind of narrow, maybe a couple inches wide, but it's very long. It goes from the outside of the trochanter head, which is actually the real hip bone, and goes all the way down to the outside lateral aspect of your knee and inserts below the joint flexion of the knee. And when that thing happens to misfire, if you will, often it won't restore itself as long as this fascial pattern is aberrant. And so we're talking about things from injury patterns, we're talking about nutritional problems, we're talking about not having enough of the right substances to heal, and I'm going to get Dr. Browning to talk a little bit about that as well as we come back after the break coming up. But this is a problem that is of tremendous consideration. We're going to talk a little bit about fibromyalgia, but this Wednesday evening, Dr. Browning is going to get into all of it. He's going to talk to you about why these problems are so resistant. You're going to talk about what you're doing that are actually making things worse. So you give us a call at 703-698-7117. Tell our staff that you'd like to attend the professor's presentation this Wednesday evening, the 2nd of November. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You listen to Dr. Tom Roselle live in studio. Indeed, we're talking about musculoskeletal pain and injury, but more importantly, why those problems don't go away, even though that you've done everything you can to make a difference. And it's often the myofascial network. We look at it as the missing link, if you will, in unresolved problems of pain. And if you don't deal with the underlying myofascial wrapper, and visualize that as a heavy piece of saran wrap or plastic wrap that covers virtually everything in your body, and it can tighten, it can lock up where it doesn't move. The fluid that should be there, as Dr. Browning talked about earlier in the show, is not there. It's dehydrated. So we have this pain, this inflammatory cascade that occurs, and it can be resolved. We're going to get into that in depth. Give us a call, 888-630-9625. That's 888-630-9625. It's time to get off those medications and, do something that your body actually can appreciate. Bernice, thanks for holding. How you doing?
Oh, pretty good. I have a question. I do a lot of, bending on my knees, cleaning, and so I was wondering what would help my knees to strengthen them, like cartilage, or I had a meniscus tear 6 years ago, and that sometimes I feel a tiny bit of pain there, but not bad. But, my knees just overall just hurt. It's something to do with what you're talking about probably. But what kind of nutrition what are the things I can take, MSM, or what is it to try, to build? And what should I stay away from?
Dr. Browning.
Hi, Bernice. Did you have an X-ray of your knee? Is there any arthritis in there as well?
You know what? I haven't had any X-ray at all.
Well,
since then, since the years.
The one thing I would say is probably get an X-ray because it helps us understand if there's any degenerative things going on. In other words, it's one thing to tear the meniscus, but is the meniscus breaking down? Is the meniscus is a pad that separates the upper leg bone from the lower leg bone. So as that deteriorates, then the bones get closer and they'll often start to rub and the cartilage will wear down. So some of the nutrients that I think that are worth investigating in are certainly the glucosamines and the hyaluronic acids. You want to make sure that it's a good source. I like the sulfate form because it's a sulfur donor as opposed to sometimes you'll see it say glucosamine HCl. I think the sulfate form is better. And some of the natural anti-inflammatories like bromelain and papain, they do a great job at minimizing the amount of inflammation as well.
And papain, okay. Is papain made from papayas?
That's correct, yep.
Okay. Are papayas genetically modified?
Well, they very well may be, but what we're talking about is they're going to extract the papain, which is the active enzyme. So I wouldn't necessarily get all caught up on that aspect of it, but there is definitely nutraceutical companies that use organically grown fruit, so you can look into that.
Organically and non-GMO, Bernice. You have to be very, very careful in today's world, because just because they're grown organically doesn't mean that they haven't been genetically modified. So you have to see both labels on the product. So go to a good health food store, tell them that you want something that is organic, but you also want something that is non-GMO, and you can get that, and they'll have both labels on the product itself. And that's the important thing in today's world. It's getting very complicated, to look at these things, but that's happening. Bernice, thank you for the call. Appreciate it very much. 888-630-9625. 888-630-9625. We're talking about chronic problems of pain that just don't go away. And in studio, your host this Wednesday evening at the Roselle Center for Healing, Dr. Harlan Browning. He's going to be getting into depth, into detail on what you can do about this. Many of you are on so many different types of medications that they're actually causing the problem, and that's going to be my next question for Dr. Browning. Call us 703-698-7117, 703-698-7117 to register for Dr. Browning's presentation this Wednesday evening, the 2nd of November, or go to our website and check it out, by the way. You can go to rosellecare.com. That's ROSELLECARE.com and check it out. Several questions, but let's get into some distinguishing pieces first. And we talked about myofascial pain syndrome. We've talked about fibromyalgia. We talked about myofasciitis. All of these are chronic, ugly pain patterns that are very debilitating to patients. They just don't go away. How do you distinguish between them? How do you know which one's which? And, if you can distinguish them, do you treat them differently?
Well, that's the $1,000,000 question. Sometimes it's very difficult to tease out what's causing what. I think that if you look at the history of the problem, when did this first begin? If there was a trauma, that's a big, if it's trauma induced, you can almost be sure that there was some sort of damage to localized tissue, and there's probably some scarring there. Can you reproduce it? So if you touch or palpate the area of the complaint, can you push on the tissue, and does that make it worse? If it does, that gives you more information that's localized. But in many cases, the problem could be coming somewhere distally. It could be upstream or downstream. Or in a lot of the chronic pain people, it could be the nervous system that's just perpetuating it and making it worse. So our brain is telling us we have more pain than actually we do.
Here's a question that's kind of interesting, and I have a way of explaining it to my patients, but I think our audience would like to know about this, because many of them probably have been in the same boat. If you have a pain pattern, your muscles are tight and you're sore and so forth, and you end up going to a myofascial therapist, and they do deep goading massage. And in an attempt to release the muscles themselves and the fibers and the like, and supposedly stripping out the myofascial layers, the patient comes out feeling worse. What happens?
That definitely happens. If the therapy is over aggressive, you can damage it further. And typically, we see that when the quality of the tissue is very dehydrated. We certainly see it with what we call adrenal fatigue. The adrenal glands produce something called cortisol, which is a natural anti-inflammatory. And when those adrenal glands become, let's say, tired, so to speak, we produce less cortisol, and we just don't control inflammation. On the flip side, when people have overactive adrenal glands because they're under a lot of stress, then we produce too much cortisol, and that actually breaks down healthy tissue. So there's got to be a good balance between the two of them.
And what you're touching on is that one organ systems that we talk about all the time is the fight-flight organism, the sympathetic drive of our body, that, the thing that we chase the tiger or run away from him with, is it produces all of our major steroids, if you will, to combat our environment. And when that system is hypo-functioning, not working at the levels that it should, it's not dead, but it's not working the way it should, it can't produce the things to protect you. So you go in to get something done that is normally productive, and it's not necessarily the therapist's fault. And that's the whole thing. It's the patient often, as you said, is either is dehydrated chronically, or, they're dealing, there's nutritional deficiency deficiencies that are being eaten up by that fight-flight system. There's not enough B12 folic acid in the body to allow the fascial linings to do what they're supposed to be doing. So now you get anything. You get a stretch reaction, you bend over to do something, or you go get a massage. That should be good for you, and you end up feeling more irritated, if you will, than what you started from before.
Yeah, so sometimes you just need to take a step back and reestablish just good physiology. In other words, making sure that the body's natural mechanisms to control inflammation are in place. Touching on the adrenal glands again and their role in controlling inflammation, another important component when we look at the fascia is the adrenal glands also produce a hormone called aldosterone that has a large effect on controlling sodium or salt in the body. So if we don't control salt, then water follows it. So if we lose salt, water goes with it. So very often these folks that have these adrenal issues will be losing too much water. So that their complaint is that they have to urinate all the time, or they like salty foods. So we're slowly drying out because we're under a lot of stress.
Yeah, and the craving for salt is your body's fail-safe.
That's correct.
It's trying to protect you.
Yep.
Except I tell patients it's okay to have salt, but not table salt, not sodium chloride. Make sure that you do sea salt, and because it's balanced and it's not going to increase retention of fluid into tissues, and it's not going to drive your blood pressure and so forth. It's actually something that your body actually needs. 888-630-9625. That's 888-630-9625. We're talking about musculoskeletal pain patterns and syndrome and chronic pain, musculoskeletal pain that just doesn't want to go away no matter what you do. And there is a reason. There's a why behind that. There's things that you can do to make a difference. This Wednesday evening, the 2nd of November already. Oh, my God, the year's almost over. Dr. Harlan Browning will be presenting this specific topic in depth at the Roselle Center for Healing. Call us, 703-698-7117, 703-698-7117, and register for that class, because I promise you're going to learn a lot. Those of you who heard Dr. Browning in the past know that this is, you're going to come back away with, oh my gosh, I didn't know that. Speaking of I didn't know that, let's talk about some of the medications people take for different conditions that cause these myofascial patterns to be irritated. We see patients with steroids, and that's they've been on them for such a long period of time, and now they have a rebound effect. But that has to do with our adrenal loop. I want to get into that, and I want to get into one other question with you. Here's a patient that, how do you distinguish a myofascial pain pattern, a fibromyalgia pattern that's localized? A lot of doctors say, well, chronic pain, you got fibromyalgia. You got chronic pain, you got myofasciitis. How do you distinguish a true myofascial problem from a diabetic neuropathy?
It could certainly mimic it. In diabetes, when you don't control blood sugar, then that sugar has to go somewhere. And what it's going to do is it's going to stick to our proteins. And we all familiar with how that affects the nerves, and we call that neuropathy. And it'll affect your eyes, and the person can lose their vision when they have diabetes. But what happens is as the sugar permeates all of the tissues, it'll actually bind to it. It's called a Maillard reaction. Just like when you're caramelizing something, that's exactly what happens. The protein becomes attached to a carbohydrate in our the carbohydrate being the blood sugar, the protein being the muscle, and then they become fused together, and over time they get greater and greater. So now we have these pain syndromes that are perpetuated from bad blood sugar.
I won't get into it on this program because we have one coming up actually in diabetes in a couple of weeks in the office. But a simple question, when somebody has this diabetic neuropathic presentation, can it be reversed, or are they stuck with it?
No, it certainly can be reversed. I mean, they're going to have to take a look closer at their diet and how they're controlling their blood sugar. Some of the things that I tell people that have these neuropathies and these diabetic conditions that have been told that there's nothing that can be done is that's just not true. And we see it all the time in our office. If you do the things that you need to calm the nervous system down, and if you do the things to reverse the inflammation and change the blood sugar, then the person will improve.
Let's go to the phones. Donna, thank you for calling. How can I help you?
Hi there. Just lately, in the last month or so, I've noticed when I'm on my knees, like if I get in my bed or something, there's a pain on the left side of my knee, a little pain. when there's pressure on the kneecap.
So, Don, are we talking about the left side of the right knee or the left side of the left knee?
Left side of the left knee.
Okay. Doc.
So the pain is on the outside of the kneecap,
Yes.
or does it feel like it's underneath of it?
It is on the left side, on the outside.
So what I suspect that's happening when you're kneeling down, the kneecap should sit, relatively equal between the two condyles, and these are the little bumps in our bone. So sometimes that doesn't happen, and that outside part of the leg, that iliotibial band that we talked about earlier, is often too tight, and it pulls the kneecap laterally outwards. So then it prematurely hits the leg bone. So very often some simple stretches, to the outside of the leg and the hip will fix that problem.
Donna, how long have you had the problem?
It's been a couple of months, and it started like a little pinprick. It felt like a little pinprick at first, but now it's gotten gradually worse.
Have you done anything that in your brain may have been a triggering mechanism to it? Did you, were you walking? Did you turn quickly? Were you? Did you play anything?
I did some really fast walking for a while to try to get my cholesterol down. But,
when you were walking, did you wear gym shoes or were you in heels?
Oh, I was in gym shoes.
Okay, good. You'd be surprised how many people would answer the other way. Okay, so here's the situation.
So I did try putting ice on it. Is that going to help it?
If it's a chronic, unless the knee is swollen as a result of immediate something that you did, ice is probably not going to help. What you may want to try is moist heat and motion. And I'm talking
stretching.
about and stretching, and just but don't overextend it. Just open and close the knee, and see if you can make a difference with that. Give that a try. But if it's muscle imbalance, the muscles have to be turned back on. It could be even starting all the way down in your ankle. If your ankle bones are out of position, it can cause a torquing effect and turning of the knee itself, and then you can be feeling that. So you have to check the foot, you have to check the knee, and by the way, you have to check the hip, particularly with what Dr. Browning is talking about with the iliotibial band on that side. It's very, very repairable. Donna, why don't you give us a call or even come to the class on this Wednesday evening. Dr. Browning will give you a lot of information. Mary, thank you for holding. How can we help you?
Good afternoon. I've had myofascial pain for about 3+ years. Not sure whether it was an injury or just that I'm a doer and climbing and moving all the time. I've been through quite a few things, and you're talking about me with the myofascial pain. I do have osteopenia. I've had all sorts of red flags. I'm in menopause and been down all sorts of rabbit holes. But in any case, I believe that my doctor has hit the nail on the head. And just listening to you guys and reading, I believe that's the situation. My question is regarding it being stuck. Just like you said earlier, when I do an aggressive treatment, or even not aggressive with the massage therapy, I end up in bed for 5 days. Or I'm actually doing the back Botox right now.
Okay.
I end up in bed for 5 days.
Yeah, Botox is not something you want to do. But, Mary, I'm going to hold you over. We're coming up to a break. I want to address that because there's a lot that you should be doing. Understanding the mechanism and treating it properly are the things that we need to do. So hang on. We're coming up to a break. My guest in studio, Dr. Harlan Browning, talking about myofascial pain. Don't go away. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle live, as you do every Sunday, same time on your radio dial, 12 noon Eastern time. Those of you who are on the West Coast, do the math. Those of you listening to us on, Skype and so forth and so on, you know who you are and where you're at. Just do the mathematics, but more importantly, tell your friends that we're here so they can listen as well and have the benefit of all the information that we try to provide for you. Because it's important that you take control of your health. That's why I wrote my book a few years ago, Ageless Health. Health is a do-it-yourself program, which, by the way, is still available. Go to our website, rosellcare.com. In studio, Dr. Harlan Browning, your host this Wednesday evening, 7 p.m., at the Roselle Center for Healing. Dr. Brown is going to talk about this phenomena, this myofascial problem that causes musculoskeletal pain not to go away and to become progressively more severe in many cases, and many of you taking medications that are causing the problem as well. Mary, are you still holding?
I sure am.
Thank you. All right, so let's talk about that musculoskeletal pain. What I want to get into, we don't have a lot of time, is you said that your physician seemed to hit it on the nose. What did they tell you?
Well, after about seeing 25 doctors, that is. So he had told me it's myofascial. There's a muscle nodule at C12. it's relieved when you put pressure on that spot, and that's the only spot where the pain is. But it feels like either a knife or a severe burning. So I don't know if that means it's the muscle spasm or the nerve or both. So what you're talking about is really pertinent.
Dr. Browning.
Mary, you said T12. Is that what you said?
Correct, on the left side.
Okay. Did you have a trauma there?
I don't know.
Did you have?
I'm always moving and climbing up and moving things, and I don't know, lifting, chairs for moving carpet. I don't know, honestly. I can't remember.
So one of the things that I would also consider in this is T12 is pretty unique in the spine because it's what we call transitional area. That's where the curvature in our middle back, the thoracic spine, actually flips and reverses itself into the lumbar spine. So it's under a lot of strain and stress. So I would also look at the mechanics of the, T11, T12, the first lumbar vertebrae, because if those vertebrae aren't moving well, then the nerve that comes out there that goes to that muscle that has the knot in it will be chronically irritated. So you can do the trigger point injections all you want, but if you don't address the underlying mechanical neurological issue that's causing the muscle to get irritated, then it'll probably come back.
If your structural system isn't aligned properly, and you have vertebrae that move in synchrony to each other, if one area moves, the other one's going to move to balance it. You have muscles also that come off of that area that Dr. Browning is talking about. The inside is the iliopsoas muscle. It originates from that area, and it goes all the way down and attaches into the hips, into the front. And that works along with other areas of your body. A couple quick questions. Never supposed to ask a woman her age, but how old are you?
56.
Okay, what have you done for work over the years?
Sales.
I'm sorry?
Sales?
Sales? Okay. All right, so...
Laboratory diagnostics.
Okay, so a lot of sitting?
No, a lot of moving.
Okay, so a lot of lifting of equipment?
No.
Okay.
Moving.
All right, so anything can cause anything. So what I'm trying to find is your mechanics that may have caused the problem. If you wore heels when you're out on the road, it hyperextends your back, so you're going to jam that area more so than any place else. If the iliopsoas muscles are off, it's going to be problematic. So you have to look at the underlying pieces that brought you to that place. There is a why is that. If it's myofascial, if you push on that area and it relieves the pain, it tells you one of a couple things. It's either the vertebrae, the bones themselves that are not aligned properly, or the myofascial layering of what's called the sacrospinalis muscle, or the spinal muscles that go all the way up in layers, and they start at your sacrum, they work them way up. But if it's pulling on the spine itself, you got a problem. Unfortunately, I've got to cut it, Margaret. I'm very, very sorry. Join us this Wednesday evening. I'm sure Dr. Browning can be very, very specific and tell you what's going on. Just give us a call, 703-698-7117. Dr. Browning, you got about 35 seconds to tell us about the program.
Yeah, I'm really looking forward to this presentation because it's the first time I've ever actually done this one. So, while putting it together, did a lot of research. So I think we're going to, bring to the forefront a lot of the underlying causes of why people have chronic pain is similar to what we're hearing from some of these callers today. So hopefully we'll educate you and give you some ideas on how to fix it.
Join us this Wednesday evening, 7 p.m. at the Roselle Center for Healing. All you need to do is call us at 703-698-7117, 703-698-7117. If you've had myofascial pain of any kind, trust me, this is a night that you're going to have the light shed upon the problem and perhaps fix it. We'll see you next week, same time, same place. Love you all.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Roselle Center for Healing reminds all women to conduct monthly and annual breast exams and consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, visit thermographycenters.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.